And I'm retired, and I was a teacher at one time. I did social work. I was director of Catholic Charities for a number of years, and I was on the school board for a long time. And I'm retired from all of those. And it's really nice to just be sitting in my garden, enjoying a lovely late summer day, and not have I didn't have to deal with so many things that are going on today in my whole career. So I feel like time, I'm not envious of any of you that all the things that we're struggling with today. So, and I just really admire the way people are stepping up and taking care of so many things. So, but I was the co-chair. I think I'm the chair now because I think the co left, but of the community coalition, and it's all about Joe Nigel. That's what the community coalition, where it gets all of its fame.
Pastor Michael.
Oh, I've been a pastor in Monroe for 26 years, and coordinator for Monroe Pastors Fellowship and congregations, chaplain for Monroe Police and Fire Department for 24 years, and few other things, coalition leadership team, and concern for the homeless, and so many other things, really. But here we are.
We are. Juliet, who the heck are you?
Hello, I'm Juliet. I am with the Snohomish Health District. I am on the Healthy Communities team there. So my work specifically is mainly coordinating a rural opioid response program grant in 2 rural-ish areas of the county. And Joe is involved with our work there, which we are so appreciative of. I also do some youth marijuana prevention work at the Health District, and then I am a part of the coalition also as kind of the representative for my whole team. So we also have other folks who do work on tobacco prevention and youth mental health and suicide prevention and healthy eating, active living kind of work, promoting childhood immunizations, the whole healthy community spectrum there. And I'm excited to be here.
Amber, who are you?
Hi, I'm Amber Ameda, and I work for the Monroe School District. I do attendance support for our students. And that's it. I don't really have any other volunteer obligations. I know usually I talk about those, and I really don't have anything right now, and it's a different life, and it's something I'm getting used to. So,
Well, you're on the Community Human Services Advisory Board, right?
I'm on that. Yes, that's true. Oh my gosh. Don't tell Rachel or Deb that I forgot to mention that.
Kathy Bernhardt, who are you?
Hello, I'm the McKinney Vento and Foster Care Liaison for Monroe School District. Welcome back, everybody. Good to see you.
Rachel, have you transitioned to your other meeting yet?
Not quite yet. Nope. I am just about to jump in the car, but yes, I am the Human Service Specialist and Project Management Consultant for the City of Monroe. And I support the Community Human Service Advisory Board. And I don't have much I can share because it's an early planning, but I've been doing an awful lot of research on the Compass Health Impact Model and Whitebird Clinic's Cahoots model recently. So
Sounds like we need to talk.
yes, please.
Okay. And Deborah, I'm so glad you're here. How are you? Who are you?
Hi, Joe. So Deborah Knight, I'm the city administrator for Monroe, for the city of Monroe. Glad to be able to join everybody on the Zoom call today. Thank you.
Thank you. Well, I'm going to share my screen really quick here. I'm tracking an incident at one of our schools. So if I'm looking away, it's just to make sure I'm not needed. So I don't think anything will come of it. Give me 1 second.
In the same, Joe.
Oh, you are? Okay. Yeah.
Yep.
Oh, we know the same people. Hold on a minute. Almost there. Okay, share screen. Oops, share my screen. Okay, there we go. So the agenda is pretty simple for today. And because we're kind of light and everybody is really experienced with the coalition, I'm going to do what I need to do to jump through the hoops so that I can report back to the funder that we are properly oriented. And so we're just going to do a really quick overview of the coalition model, the Community Prevention and Wellness Initiative model. I know you know it, so I'm going to be quick. I have some business updates to share with you. Then really just want to focus on what's going on in your world, what needs do you have, what opportunities are out there, like what are you hearing? So we're best when we're networking and coordinating. So I'm going to try to make this as painless as possible. Yep, Tom right now is the coalition chair. Mary Myers and Pastor Michael Hanford and Sherry Matias have all been on here forever. They're some of the original founding members, along with Kathy and Amber and others, and they've helped to guide us to our current success. I am coalition staff in this regard, and our prevention, our student assistance professional, who's better known as a prevention intervention specialist, is the other staff assigned to the coalition and our community as a result of the grant. What's up?
She doesn't have the link, so I'm sending it to her now. I just texted her. I was like, are you coming? So.
Oh, I will work on that. Thank you. The coalition model is really based on the idea that we can't address these big community issues alone, that substance use, mental health disorders, violence, teen pregnancy, school dropout, juvenile arrest are not the fault of the school district, not the fault of the city or the police department or, Catholic Community Services or Housing Hope, right? But even though it's nobody's fault, the only way we're going to be able to address these issues is through coordinated efforts and partnership. And so the coalition for the past, 8 years has really been dedicated to coordinating tiered evidence-based practices within the community and within the school system. We've leveraged a lot of money in order to support our behavioral health system here. And the CPWI model, the Community Prevention and Wellness Initiative model, really transformed how we've been able to move the needle for everybody. So for those of you who remember, Monroe was the third highest community in 2013 when we agreed to be part of the community initiative. And today we're one of the most protected communities around the state. Our kids are doing very well because of the efforts of this body and our partners. So right now, CPWI is in 82 sites, in 95 schools, in all 39 counties. Cohort 7 participants were just announced. In our community, in our county, Granite Falls and the city of Sultan are the newest CPWI members. So what that means for us is we're going to really be able to partner up the valley and really start working on whole valley issues, not just Monroe issues or incorporated Monroe issues. So we are a community-based model. We don't pick programs without coming to the coalition. We don't set our vulnerabilities or our risk factors without going to the community for context. So we really tap into community wisdom in order to take a data-informed approach to how we address these issues. And the coalition itself is an acknowledgement, again, that these issues are too big for any one agency or system to handle on their own. The coalition's essentially an arrangement for cooperation and collaboration between different groups and sectors of our community. And we are regularly attended by school district personnel, Housing Hope, NAMI, the ESD, the Y. Seymour Behavioral Health is a really key partner. Our faith community has been critical, the police department, local nonprofits, the health district, Monroe Public Schools Foundation. So we have regular support from each of these agencies, and they comprise different sectors of our community: moms and dads, grandparents, youth, law enforcement, businesses, healthcare, and so on. And so by our contract, we're required to have diverse representation. And that means that we have members, recurring members, from at least 8 of these sectors of support. This year, we will be collecting new Healthy Youth survey data, which is primarily how we understand risk in the community, and taking that data to the community to help us understand where our true needs are, what resources we have in the community that are addressing these needs, and what gaps exist, so that the coalition and our partners can start to plug those gaps. We'll put this all together in a strategic plan 2021. Our most recent plan is from 2019, and these plans are updated about every 2 years. And so our goal is to fund programs that work as stewards of taxpayer dollars and the youth in our community. We want to fund what we know will work across settings and populations. And so the word evidence-based means something very specific. So when we talk about best practices, that's more a marketing term. Best practices help businesses to be more efficient and to get the largest return on investment. Evidence-based practices mean that these programs have been rigorously evaluated for doing good and for not doing harm. So there's no accidental harm done by the practices that we support if they're implemented with fidelity. And I showed this at the Community Human Services Advisory Board the other night, so sorry that you have to hear the repeat. But what we really do is based on the risk and protective factor model of substance abuse prevention developed by the University of Washington School of Social Work in the late 80s and early 90s. J. David Hawkins and Rico Catalano found that there were 24 risk factors that actually predicted engagement in substance use, delinquency, teen pregnancy, school dropouts, violence, and the development of mental health disorders like depression and anxiety. And in Monroe, what you see in the blue highlights is where our community is vulnerable. And then to read this properly, when we have a program that addresses low neighborhood attachment or community disorganization, the checkbox shows what areas long-term this will impact. So addressing low neighborhood attachment decreases long-term rates of substance use, long-term juvenile arrest rates, and violence rates. And then you can see, on the other hand, when we put parenting programs in the community, like Parenting Wisely, this is actually addressing every major predictive problem area. So the family context is predictive of a variety of health and opportunity issues. Since 2013, we've raised more than $2.6 million in grant funding and resources. You can see that when we just started in 2013, we had our primary grant and our grant with the ESD. And where we are now is we leverage fund sources from all across the county and the state in order to do the work that we're doing and provide the safety net that we're providing for youth. The goal is to reach them where they're at. And so even early on, the principles that we've operated under is to first do no harm, because we know positive intentions can cause unintentional harm. We prioritize evidence-based strategies in order to do that. We've always provided training to our staff with our partners within the school district, within the community, and parents as well. Our focus has been to help move the district from more compliance-based strategies to more youth development focused strategies. And I wrote this in 2015, And it's amazing to see, like, point for point, we've accomplished this. Our goal is to acknowledge that we serve whole children. They're not automatons who enter the school district or who enter an after-school club or the Boys and Girls Club or the Y as Y members or club members. They're whole children who are products of their society, community, relationships, and individual risk and resilience characteristics. And then a lot of the work that we've done has been identifying deeply entrenched programs in the community and helping to replace those with productive strategies. The coalition really employs a public health model. And then Mary and others who are joining us, I explained to everybody that this is part of how we have to jump through the hoops. September, I have to go over a coalition overview, just so that we ensure common understanding. And then we're going to move into partner sharing. But for now, I'll keep going through the overview. We employ a public health model. So the medical model is a group of specialists who serve people one-on-one to attend to their needs. The public health model says we get more bang for our buck when we do strategies that target everybody. And then for those who are not well served by the one-size-fits-all strategies, to provide support to people who have common risk or protective factor characteristics. And for those who are not served in those smaller groups, then we provide one-on-one supports. And so the coalition has really installed a variety of one-size-fits-all tier 1 strategies that are really alleviating the burden on our specialist supports. So a strong tier 1 frees up resources at tier 3. But in elementary schools, we are implementing the second step social emotional learning program, K through 5 at every elementary school. By the end of this year, we'll have 3 schools fully implementing the PACS Good Behavior game. And I'll show you something on the PACS game in just a minute, but PACS is powerful. Salem Woods Elementary, Frank Wagner Elementary, and Maltby Elementary will be our primary implementers. And my goal is to get us to 100%. Our middle schools have been using the Botman's Life Skills Training Program since 2006. And for long-timers here, guess who's funding that right now? The district is funding it this fall. So that's a pretty big deal. We'll see if we can keep that going, but that's a big piece of sustainability. We will be implementing the Sport Prevention Plus Wellness Program, K-12 or where appropriate in elementary, but at least 4th grade through 12th grade. And sport is basically a healthy behavior goal setting program that shows powerful underage drinking and marijuana prevention outcomes. And what's amazing is it works in a single session. So no other program in the world is documented to work in one session, but this one does, and it kind of works like magic. And we have Stephanie Phillips on here is implementing Project Success for us at Monroe High School. Project Success is a tier 1 strategy in that she pushes into classrooms to do classroom education. We also do Sources of Strength, and we're funding that in partnership with the Volunteers of America Western Washington, who applied for a grant with us this year. And we implement the Signs of Suicide program, an evidence-based suicide prevention program in 6th through 12th grade. And then we do a variety of trauma-informed practice training in the community and with our partner agencies across the region. We're offering youth mental health first aid training this year, hopefully multiple times. We offer Parenting Wisely, which is being delivered by Take the Next Step. We're engaged in multiple awareness campaigns. And this year we are incorporating the comprehensive school counseling program into our team. So we'll have one comprehensive school counseling and behavioral health program moving forward. At tier 2, so among groups that have common risk characteristics, we are doing community awareness campaigns. We're doing a specialized program called Check and Connect that we just received funding for, but we haven't trained in yet. Coping and support training will continue. We've trained every school counselor in the district to implement this program and a couple of other partners. And then where Stephanie Phillips really shines is in her Project Success small groups and her one-on-one support for students. Although Stephanie shines everywhere. What the coalition has been able to do, though, is consolidate all of these teams, either through direct supervision or just through intense coordination in a way that better serves students or serves students more effectively than really ever before. And so this includes, because of our friend Mary Myers, the district's behavioral health specialist, who's a licensed mental health counselor and child mental health specialist, our mental health counseling partners at CMAR, who provide on-site mental health counseling, our case managers that are funded by Snohomish County, known as student support advocates. We have a dual licensed co-occurring disorders therapist who provides a 16-week treatment course to students experiencing both mental health and substance use disorders. Stephanie is our student assistance professional implementing Project Success. Kathy Jackson and Carlos Ellis coordinate really closely with our team. They're our family outreach liaisons. They're essentially the face of Monroe School District. Kathy Bernhardt is our McKinney-Vento and foster care outreach liaison, and is just a critical part of this team too. Amber Mehta has transformed BECA, or attendance outreach, from being litigation focused to being essentially social work focused. So we're really trying to identify root needs and put services and strategies in place and wraparound supports in place to help them do that. And then this year, we'll be integrating the comprehensive school counseling program into this model. By the end of the year, we need to adopt a nationally recognized framework. And what we'll be doing is creating an adaptation of the American School Counselor Association framework, which doesn't include access to these resources. So our model will include how we refer internally to those resources. And then I'm going to pass through, because everybody here essentially knows what works and what doesn't, and we'll save this for a community meeting. But the emphasis on evidence-based practice I mentioned earlier was because well-intended practices that don't have a strong research base can do harm. And so DARE is my great example. I was a part of DARE. A lot of my friends were a part of DARE. Even though DARE was very well-intended, there have been at least 8 studies done since 1998 that have demonstrated that DARE was absolutely ineffective at changing substance abuse rates or initiation rates. So the number of kids who would start who normally wouldn't, and actually increase the likelihood that vulnerable kids would start using drugs and become involved in the criminal justice system. So DARE, although well-intended and very popular, it was practiced in 75% of American schools. It was implemented in 52 countries. It generated an annual revenue stream of $1.3 billion per year. And this is in the 80s and 90s. They hurt tens of thousands of kids across the country. So we don't do that. We make sure that our programs are either evidence-based, they've been rigorously evaluated, or they align with evidence-based principles. And there are a lot of predatory programs out there that say research-based or research-aligned or best practice or promising practice, and they're really not tied to what those words actually mean. So I mentioned that we're implementing the PACS, Good Behavior Game, that we're expanding to 3 elementary schools this year. And PACS is like the premier program in the world in terms of reducing future suicide and mental health disorders, future substance use disorders. It decreases special education needs, decreases suspensions and referrals, decreases arrest, decreases personality disorders. It increases college admission rates and increases high school graduation rates. And it's not even a curriculum. It's a series of strategies for how we treat kids and how we respond to kids in the classroom. But so just showing data, our last full year of data was 2018, 2019, because that 19-20 school year was disrupted by school closure and the pandemic. But what you can see here is that PACS teaches self-control. That's why the strategy has span of life impacts. And every year that we've implemented at Maltby Elementary, our primary implementing school, we've achieved between a 60 and 80% reduction in classroom misbehavior. And so as students learn these skills to self-regulate, they're less likely to engage in substance use, in eloping behavior, in juvenile delinquency, and a variety of other challenging behaviors. So prevention works, and it works right here in Monroe. University of Washington's Impact Lab has been doing a number of cohort studies since 2011 when we first implemented CPWI. And what they found is that every community that's implemented this coalition model has increased on time and extended graduation rates, and they've decreased dropout rates. So it's had powerful academic impacts, even though we're not necessarily offering tutoring or extra academic supports. CPWI has helped to bring our opioid use rates, especially in Monroe, down from being way above the national average to being right within the state and national average. And locally as well, more students today tell us that they have an adult to turn to for help than ever in our history. And so we've been tracking data since 2000, and kids have the most adults to turn to for support now. Our attempted suicide rates are the second lowest rate ever recorded, and our lowest rates in more than a decade and a half. Our alcohol use rates are the lowest rate ever recorded. Our binge drinking rates are the second lowest rate ever recorded. Our marijuana use rates, even in this climate of retail marijuana use, is the second lowest rate ever recorded. And we shouldn't be seeing that. We should be seeing among the highest rates ever recorded simply because access has gone up. But the coalition programs and the work of our partners have really helped to bring these rates down. Our prescription painkiller use rates are tied for their lowest rate ever. And our prescription drug use rates that are not opioids are in their 6th year of decline. This data is not new. It's 2018 data, which is the most recent data available. We'll have our community participating in the Healthy Use Survey this fall in October. And so we'll have new data for the first time around the beginning of April. So we'll be able to really see how the pandemic has impacted rates. What we were talking about earlier and what we know is that youth mental health distress has gone up. Youth suicides and substance abuse rates seem to have gone down based on some statewide surveys that have been done, but Monroe hasn't participated in those. So we'll see. I'm hoping that the protections we've engaged in and the modifications we've made through COVID really have led to a protected community. So my fingers are crossed, and I'm so grateful for everybody. Any questions about what CPWI is, how we fit in, our focus on evidence-based programs? Just blurt it out, because I can't see your hands.
Joe, I have a question.
Please.
This is Mary Myers. You were speaking to healthy communities and all of the data that suggests we've made significant strides over since 2006, essentially.
Yeah.
How the concern that we have had within the leadership team of the coalition, one of them has been our ability to engage the community more broadly in understanding the work that is being done in Monroe to support youth and families. And I heard you say, as I joined the call, that you had spoken a couple days ago to a group, and I'm wondering if those efforts, if that's something we need to look at this year, is sharing the good news more widely to help people understand and perhaps join ranks, because I would wonder when we do community survey, if the perception of areas of concern for youth risk is consistent with what the data is showing us.
Oh, that's a really good point.
It's just more of a comment and perhaps an observation.
Oops, let me stop. Let me see. I want to see you. Give me 1 second here. Stop sharing. Okay. I wanted to see you, Mary. Hi.
Hi.
There you are. Yeah, I mean, this is an area that shows up in annual community survey all the time. we don't have very broad recognition across the community for our efforts and for what we're doing. And we just did a community survey through the school district, a survey called Bright Bites that was developed by the American Institute for Research. And this showed up even within our staff, that they weren't aware of the really extensive supports that youth have access to in the district. So I think what's out there is Compass withdrew, CMAR's in transition, and there's no support anywhere. But I think one of our focuses has to be that help's out there, and we've helped to bring it to you. But I'm open to ideas and passions. Do we have anybody on the call who is a great communicator and loves promoting what they're doing besides for me? I mean, we can tap into the district to issue press releases. I mean, we can really promote what's out there. I think we have opportunity.
Yeah, Joe, I'm really thinking of it more in terms of linking arms than touting success, because we don't really know what our current data tells us until we
I see what
get
you're
some of
saying.
these data back. We really don't have any data from the last year and a half. But I think this is an opportune time as we hopefully start re-engaging in the real world, that
Yeah,
it's an opportunity to look at this comprehensive model and see perhaps, I mean, I guess we want it to go from the schoolhouse to the community, right?
definitely.
And so are there areas with our community partners that we can bolster that support and success? So it's really just more something for me I'm voicing to the group, but I'm really just jotting notes and kind of, what do you call that? Putting on that board for further consideration.
Yep, parking lot.
Yeah.
I don't know. Rachel, are you still on?
Yes, sir.
Rachel, you're one of the most networked people I know at this point.
That's
Do you
awesome.
have
Yeah, I was
any
totally thinking, I'm
ideas about
so
how we
happy
can
to
promote
help.
this?
Yeah, I am so happy to help. Like if you want to go on roadshow with your presentation, or if you want to, you know, find ways to communicate, I am so happy to help, Joe. Anything you need.
Okay.
I think that I think what Mary, you know, is bringing up is really important, because, you know, is it the perception that we're trying to fix, or is it the system? You know, and that's one of those things where it's both, yes, but I think the perception that it's not there, what you said, Joe, is so important, that we have to share that there is hope. So I'm on board.
Juliet, how do you guys get the word out? I know you have Heather, but
That's a great question. For district-wide stuff, we really rely on our communications team. For program stuff, like, you know, for our Healthy Communities team, we in the past couple years just started doing like a newsletter that we send to like prevention staff and I think nurses at schools, or maybe it's a separate list, but which is, you know, a little old school, but it seems to be a pretty good way to get the word out from our program specifically. But it does require, you know, knowing exactly who we want to send things to, and I think we always miss people, so it's not perfect.
Paul, have you found anything that works?
Well, I'm just starting to dabble into communications here. I mean, that's a function of my role here. I would say that I don't have much to offer in terms of, you know, experience. I think, you know, law enforcement communication is a thing in and of itself, and I think we need to do a better job, even personally, to share our story. So,
Okay.
I wish I had something to offer, but I don't.
Any other thoughts or ideas? I mean, this won't be the last time we talk about this. Okay.
Well, I wanted to add in briefly that Mary, I completely understand the point you're making, but I think it is also okay to brag a little bit about the work this group has done, because I think it's really phenomenal. And I think, even just in our community, larger community, and the region and the state, what this group accomplishes each year is really impressive.
You're very right on that. Yeah, I think that is so true. And I do want to say too, while Paul is with us today, when we moved away from DARE, which, as Joe said, was an immensely popular program in our community, and there was tremendous buy-in, and you couldn't drive down Main Street without seeing bumper stickers talking about their DARE children at a certain school. We involved Monroe Police Department in transitioning the program. So we had 2 officers that actually participated in the full training with the Botvin educator, and then were present in the schools and the classroom, because I think although DARE was shown to be not that it did do harm, I don't want to diminish the secondary benefit that came to us as a community from the relationship with the officers. So the officers continued to be on campus and interact with kids, and that personal relationship building was critical, just as it is with our personal safety program. Because although that's more anecdotal perhaps in terms of the benefits, but I think that's one thing that has always impressed me with Monroe is the personal relationship piece, and that, kind of rolling up your sleeves and getting a job done well because people reach out to other people as individuals. And I think you're right, we do need to tout the horn, because I'll bet there are people at the state level that know far better how successful Joe has been at the helm in orchestrating what we have now, which is an incredibly model program for the nation. And yet, if you were to ask people within Monroe, they wouldn't know most of what's going on. And as it was mentioned, that sense of knowing that there is hope, that families can reach out, that there are mechanisms, is so important to get the word out. And we're not just a school district entity. Our reach extends beyond the schoolhouse.
Yeah. Okay.
I would just echo some of what Mary said. One of the incredible things that DARE did do in a positive way was connect young people to some of our caring police officers. And I think that was then continued on in what Mary was talking about in the personal safety training and various things that we developed in that. I don't know the exact program's terms. Mary, you would be the one to remember that. But in our Police and Fire Appreciation Week each year, and the booth at the fair that's dedicated to that, there is the spreading of some of the great things like Shop with a Cop and various other things the police are doing to get that into the community and to help them know some of the great things that are happening. The police led the way at the freedom marches last year after George Floyd. There's just been such an incredible presence in the schools. In Police and Fire Appreciation Week, another thing, we have police and fire when we're not under COVID lockdown. We've had police and fire visit the schools and have time in classrooms, and great things that kids are seeing. The fire department has had open house every year at the fire station, where kids and parents connect with the department and the personnel, and those are great things. Those are absolutely great things.
Yeah. Okay, I'm gonna hurry up and do some business updates and then we can really talk. So I'm so sorry we have to do this every September, that nuts and bolts piece. Let me share my screen one more time, eventually. There we go. Okay, so just a couple of things I want to put on your radar here. So you may remember that we were awarded, along with Volunteers of America Western Washington, our partners in a grant application, funding for mental health strategies in 2021, 2022, and 22-23. And so that funding pays for our district-wide implementation of the Signs of Suicide program. That's a tier 1, so one size fits all. We're going to decentralize sources of strength. So one of the things that we found with this program is, as it started to take root, and I don't know if you remember this, but our youth coalition won health district and state awards for their incredible work through sources of strength. But it was so effective that other groups and clubs within the high school started doing their own mental health activities and wellness activities. And so what that meant was you didn't have to miss AV club, you didn't have to miss football practice, you didn't have to miss, 4-H in order to take on wellness. And so that caused us to have dwindling membership. So we proposed this year to Sources of Strength, and I'm meeting with Dan Adams tomorrow on a conference call, a decentralized model where we train club leaders and key representatives from each club in this model, and they'll still be responsible for mental wellness activities. They'll just come from the Sources of Strength catalog. So we'll have a coordinated but decentralized Sources of Strength implementation. And it sounds like they're really excited about that. And I don't know if anybody else has done it. So I'll find that out tomorrow, but that's the only way we're gonna make it work. And it's interesting. We'll be offering at least 2 youth mental health first aid trainings through this grant this year. Our behavioral health specialist, Jennifer Swan, just earned her national certification as a trainer. So we'll continue to provide this with in-house resources. It just saves us so much money. And then we have 4 folks who will be trained in the coping and support training program this year, that suicide prevention small group program. And so that will be out there. And then we'll also be promoting our mental health access campaign among Spanish-speaking community this year. So we did receive funding to finally start disseminating the ads that we developed with another grant when we did focus groups a couple of years ago to find out just how we can break down stigma about letting families access. Because one of the things that came through our Spanish-speaking focus groups was that our Hispanic and Latino community were very aware of the resources that were available. And once their husbands or uncles or grandpas or brothers found out about it, they made them stop. So we had a number of incidences where my team set up pro bono services. And as soon as Dad learned about it, he forbade his family from participating. And so this campaign, Let's Get Better, was all about our focus group's desire when they immigrated to America to create a better life for their families, to be better husbands, to be better fathers, to provide better opportunities. And what we found in focus grouping was that talking about mental health was a sign of weakness. You just don't do that in these communities. But talking about becoming mentally strong or focusing on our family's mental strength really appealed to them. And so that's what this campaign is. It's about that, let's get better and provide better for our families. So let's get better as fathers, let's get better as brothers, let's get better as grandpas and uncles and cousins, and understand our family's mental strength. And so we're hoping that because we're using their language, we're using what matters to them. that will be able to break down some barriers to the supports we have in the community among this community. So that's what we're going to try to do. And we have the money to do it. This year, we'll also be continuing the PACS Good Behavior Game, Project Success through Stephanie, the Prevention Plus Wellness Program, like I mentioned earlier, the Parenting Wisely program, Botvin's Life Skills Training Program, and we'll be continuing our internet and movie theater campaign, Teens Are Under the Influence of You. It's a parent prevention message. We are expanding again PACS, and this is what's up. So I'll share one other screen just so you have a glimpse of what's going on. We have so much happening. I had to create essentially a project management spreadsheet, and I'll just show you this briefly. We won't focus on it. Oops, that's not it. Stop. Share. So what you see is kind of the months from July, which passed, until June for this year. We do have our annual community. Oh, it's not showing that screen, is it? You can't see my spreadsheet, can you? Oh, yes, you can. Okay. Okay, let me cancel this out. That's better. So what you can see is in October, we're going to have to do the coalition assessment tool. We do that every October. It's required by contract. In October, we'll also be launching the Healthy Youth Survey in 6th, 8th, 10th, and 12th grade. And probably by the end of this month, I will get all the annual community survey links out to you. We're required to do this every year. We need a minimum of 270 respondents for a community our size in order to meet contract deliverables. And last year, we were almost at 600. So it's valuable data for us as we move forward, each of these, as we move forward with our strategic plan. Yep, in terms of our substance use disorder programs, we'll continue Parenting Wisely in person and online, Project Success, Sport, PAC, Second Step, and Botvin's Life Skills Training, Coping and Support Training, Check and Connect, Signs of Suicide and Sources of Strength are our funded suicide prevention programs. We will continue the Under the Influence of You campaign and the Let's Be Better campaign, I'm trying to track down funding right now for You Are Not Alone. Coalition program and training. So yep, we'll be doing CAST training. Actually, I have updates now from October through December. PACS Good Behavior Game training will be happening at Salem Woods Elementary probably next month or at the end of this month. Sources of Strength training, we're negotiating right now. Check and Connect training, I just haven't had time to address yet, but that's coming. We need to do a training of trainers training for Sport Prevention Plus Wellness. So I'm talking with Dr. Wirch, the program developer, about that. We just put out a call this morning before the coalition meeting about Botvin Life Skills training needs and materials. So I'm not sure if we have new teachers who will be implementing this year. If so, they'll need to be trained. And Jennifer, again, just completed her Youth Mental Health First Aid Training of Trainers training. So in terms of community trainings, right, again, we're going to be offering Youth Mental Health First Aid to the community. We're already starting to push out key leader orientations. That's why I promote, that's what I was at a Community Human Services Advisory Board earlier this month. Jennifer Swan will be helping to push signs of suicide and suicide prevention trainings in the community to parents. We're continuing to provide regional trauma-informed practice and kernels training. I just did one for our Snohomish County Court-appointed special advocate program, so they understand how to work with trauma-impacted youth. They foster youth separated from their families because of violence at home or other issues involving abuse or neglect. And since they serve Monroe kids, I wanted to make sure we equip them with that training. We will continue to be doing community film screenings this summer with some extra funding. We essentially purchased a library of potential films to screen in small group formats or online formats, so we can continue like brown bag lunch or evening conversations. But my hope is that we'll be able to actually be in the Galaxy Theater this year for a big conversation. We do have the funding for a digital cinema projected film. And then this year we're required to submit an all new strategic plan. So this is kind of what's on the agenda for today. I mean, for this year. This doesn't include what we actually do to push out. So a lot of this is like the behind the scenes coordination that I need to do for you to implement your programs. But in terms of our work together as a coalition, how we push out into the community, the conversations we engage the community in, how we support our partners, that's really still to be determined by you. And like my one steadfast commitment, because I've failed on this promise for years, is to make sure that we have a community letterhead, a coalition letterhead for Mary Myers this year. I owe you. I owe you.
Yeah, you do on that regard.
So, okay, that's the year in a nutshell, not including what we do together. And so our meetings will be less about the nuts and bolts businesses. I'll give you business updates, but we'll really be focused on what's the work that's important to us as a coordinated body. So this leaves us with partner updates. If you're still on, I thank you so much. I'm sorry this was boring, but now I can check this off of the grant box. Deborah, oh, you need to leave at 2. So, oh, thank you. How about if we just go and just let us know what's happening in your world, what kind of support you need, what challenges you're anticipating, just whatever comes to mind. And since we have Juliet on here, I want to start with Juliet from the Health District.
Thanks, Joe. I will say what's going on in our world, healthy communities wise, is just kind of trying to get back to normal. I think we were obviously all optimistic the fall would look a little more normal than it seems like it'll be looking. So, you know, we are kind of starting to get back out and do some in-person events and stuff. But I think for the foreseeable future, we'll probably continue just doing more communication and support and everything virtually for all of our programs. And we have a new tobacco prevention coordinator person joining us at the end of September. So I'm really looking forward to her joining our team and kind of getting up and running with things. She's been working with one of our COVID teams for the past year. So she's great. She's a ton of experience. So I think she'll be a great resource for the health district, but also in what we're able to offer and partner with for the coalition. And
What does that partnership look like, Julia?
the health district with the coalition?
Yeah, the tobacco prevention partnership.
So she's the person who will be joining our team is basically replacing Jennifer Reed, who was in that position. And Jennifer is now working with our public health emergency preparedness and response team doing currently COVID work. So I think mainly she'll be doing a lot of the same things that was kind of in Jennifer's wheelhouse, with a bit more of a focus on some policy systems, environmental change work. And I think generally, COVID is our main challenge right now, and just trying to manage that while we manage all of our normal work, and knowing everyone else's work is so disrupted. So, but I will say that, I am always available and happy to connect anyone with anyone else on our team as needed for support or training or partnering or whatever. So I'm expecting to continue being the person who is part of the coalition, and I'm very grateful to get to do that. But I also represent a bigger team. So
Thank you. Commander Ryan, what's happening in your world? What are you seeing in the community?
Yeah, I would say policing in a pandemic is challenged. I think I can speak to, 2 challenges, not necessarily related to COVID, but prescription drug abuse. I know you've seen a decline in it. I'm not doubting that, but I think the danger of prescription drug abuse is getting worse. I can think of 2 fatal deaths that we've dealt with over the past, 90 days involving youth in our community.
Yep.
And so I've actually I've tried to be proactive and reach out to the medical examiner's office. I've spoken with the sheriff's office PIO to try to put together some piece related to the M30s, which just have high doses of fentanyl in it, because I just worry we're going to start to see more accidental overdoses related to the M30s.
Yeah. Would you tell everybody what that is?
Yeah, it's basically it's a pain pill, but it's disguised and it's not serving its function, and it's got enough fentanyl in it to kill somebody. And so when they think they're taking just a normal pain pill, which probably isn't prescribed to begin with to them, they're actually taking a fatal dose of fentanyl. So, and it's a tragedy. So. The other thing I'd point to is just the legislative reform that law enforcement agencies are trying to get ahead of, and it's been a challenge this past year. But as I kind of look to how that affects our interaction with youth, where we're seeing some of our biggest challenges is with at-risk youth petitions through our local juvenile court, but also runaways. So we've had instances where we've identified the whereabouts of a runaway, and the parent has asked us for assistance in trying to retrieve the child, and the child basically doesn't comply with our words and actions. Now, in the past, we would have been able to physically escort the kid to a parent, or to CPS, or to Cocoon House, and the new legislative changes have basically caused us to only put our hands on people when there's probable cause for a crime. And so we've had an instance recently where I know an officer was with a parent at a house where multiple kids were at, and we basically just had to walk away and really not render any assistance to the parent or the child, and the child remained in the situation. So so that some of the ramifications, you know, we're still trying to figure out how we can serve the mental health needs of our community, because that appears to be the biggest challenge that law enforcement's facing as a result of some of the legislative changes. So,
yeah. Okay, so what you're telling me is we have less tools available to address high-risk youth and mental health needs than we had just a year ago.
Yeah.
Okay. And what you're seeing is an increase in synthetic opioid use, particularly dangerous opioids like fentanyl.
Yes.
I'm sure that the data will bear that out.
Yeah.
That what we looked at was old data. We had momentum, and then the pandemic hit, and we don't know what, like Mary said, we just don't know what we're looking at. You do though.
Yeah. I'll leave you with a positive, because those are two negatives. I got to see some smiles on the screen. We're happy to have our school resource officer back up at the high school and providing that outreach to youth in our community. So he got started this week. So.
Yeah.
May I ask, Paul, the only way I was aware of those youth deaths was through social media. And I suspect there's been a lot of chatter among youth, and as they come back to school, has there been any conversation with high school, middle school administrators about addressing without making the tragedy a poster child for what not to do? I'm just wondering, and Joe, in terms of your knowledge of evidence-based programs, how do we address this? Because it certainly sounds like it's a critical need right now.
I can answer the first part quickly. These particular deaths are, they're difficult for us because there is a criminal component to it. So, we try to protect the investigation as best we can, because the supplying of drugs that lead to fatal death is a crime. It's substance abuse homicide. So I would say it's a delicate one for us to really get ahead of this in the community and really use the case as a poster child.
Right.
And I think that's what makes the messaging piece so difficult. So I have not communicated with the schools on this one. you know, I think I'm open to it just because I know the community impact that this problem can have.
I think there's opportunity. Let me really think about this. You're right, Mary. We haven't brought this to the classroom, but
Yeah.
it's dangerous, right? Like Paul said, these look like one thing and they contain something else. And like you said, the criminal component, if you're sharing with your friends, you could go to jail if you hurt somebody. So let me think about this. And I'll probably bring some of us back together. So I'll need your wisdom.
Well, I understand the police department's limitations because none of us would want to impact an investigation. So, you know, in the absence of a strong partner at the table on this, I guess I'm going to trust the expertise of you, Joe, and our partners in terms of what an intervention might look like. And in respect to the families and the youth involved, I know that there's a very delicate balance.
Juliet, are you familiar with opioid prevention? I know there's some nuance between or with opioid prevention. Are you aware? Maybe I'll tap into your brain too. I don't have the right question to ask right now because I don't know what it is.
Okay, but yeah, let us be in touch when you have the question.
Okay. And then there are several communities that are SOR communities. They receive a state opioid response grant to specifically address opioid prevention in their community. So SOR coalitions. And I'll see if I can reach out to them and see what they've learned as effective too. So, okay, I won't forget that. Amber, what's happening in your world? What are you seeing from an attendance perspective this week?
Well, I do have a lot of students who did end up working last year because they weren't in school, and I'm still struggling with that. And I do hope that I found something very interesting out when I did have to file petitions at the end of last school year. So in June, because once they hit 10 days within a month, I could file them. And it's really interesting and sad and frustrating because all the students that I filed on had single mom households.
Wow.
And so what bothers me is that it's like if it's all the same thing, then that's the problem. It's not the family's problem. It's not even the mom's problem. She's with the kids. You know, so I'm trying to strategize how I can get these supports to these families that have a single parent. And it's not. Why should it be on this one person? What supports do they have? How can we be the supports? Because they don't have it. So that's something that I noticed. One of the things, though, if anyone's interested or knows what I do at the beginning of each school year, is I do go around to community resource providers, and I like to gather volunteers because when I do file a petition, we do a community engagement board. And so the families come and we create a plan, and people from school, their SSAs are there. And sometimes counselors, sometimes somebody who maybe the student identifies they connect with could be there. And if anyone here is interested, it's just providing information like, hey, here's a plan, here's an idea, here's a way you can volunteer, you can get credit, here's a way that you can engage yourself in the community, because a lot of the students I work with are just not connected, and they're just kind of lonely and isolated, and that's what we need. And so if you want to be a part of that, it's not a huge commitment. I probably will do them once a month. I try to do 4 at a time, 4 families at a time. But that doesn't mean you stay the 4 hours. It could be 1 hour. The commitment level is what you want it to be. And I do a little training beforehand about some of the things that I kind of just described to you, is like, who are we talking to, and what kind of families, and, what are some things that we can be aware of beforehand. So that would be really helpful if something you're interested in talking to me about more on a personal level, or, I always go to places like the food bank. Well, there's lots of volunteers there, right? So they have a lot of, and so is there anybody there that wants to do that? Or I did go to, I've gone to CMAR, all the most obvious places, but if there's anywhere else where you're thinking, Amber, you should go and talk about this at this sort of meeting, that would be really nice and helpful, and I would really appreciate it. So that's kind of what I do at the beginning of the year. I kind of create that, those partnerships within the community. Yeah.
And Amber did something really important for us that nobody would know. Our team uses a risk assessment called the Washington Assessment for the Risks and Needs of Students. So when we're intervening, it helps us to understand where we need to focus our efforts based on what's happening in their life and what the context of their life is. And Amber applied for a 4-year grant for this service and was awarded it. So the next 4 years of this assessment is paid for because of Amber. So.
And that means I can have a district cell phone to contact families, because the money.
Did you find out?
I'm so sorry.
Oh, just want you to have an office phone, right? We just want you to have an office phone.
Yes, that is what we should do that first.
Thank you.
All right. Thank you, everyone.
Stephanie, what are you seeing this year?
Hi, everybody. Well, it's been interesting to be here and a part of this during kind of the first few weeks of school. So I started last October. I didn't have that experience, and even if I had, it was all online. So what I'm seeing is just a lot of excited students. What I'm also seeing are teachers who are willing to go, it seems like, at least so far in September, a little bit above and beyond, because they know how difficult the last year was. And so I've made some really great connections. I met Officer Robinson today, and we have some new security, and just made those connections. And Officer Robinson was great. Like, he had a very positive outlook. And he says, if you just want me to come in and just chat in a not in trouble kind of way and demeanor, I'm more than welcome to do that. And so I'm really happy about how we can partner sort of moving forward this year and what that will look like, because I think with it having been a hard year, even just, I was interrupted earlier, a student came by with a counselor just saying, hey, last year was really hard. I got into some stuff. I just want to know where my supports are here at school. And so I think having sort of more of an open door policy, not that we didn't, but I think they're just so unfamiliar with where their supports are in school. And it's been great. A lot of teachers were remote for much of the year. And so I've been able to go and say, hey, if I have any downtime, is it okay if I just come and join your class and can facilitate? I can be your TA for a little bit. And then, connect with students that way. End of class, they can chat with me. And I'm almost had unanimous, oh, of course, absolutely. We'd be more than happy to have you come in, and just that physical presence that was lacking last year. I'm optimistic about how that will impact my project success curriculum, which I think I'll do in October sometime. I haven't set the dates with my English classes, which is the class I present in yet, but I'm excited for it. I'm gonna have to brush up on my teacher skills and my public classroom presentation skills. And I think it's just opening the doors, because we're anticipating a little bit more, like everyone's on this high, but we're anticipating like, okay, once there's maybe a little bit of a crash after school really kicks in, it's just syllabus this week, and it's just like classroom expectations. So everyone's like, this is easy. But I think once it starts getting hard, there'll be a little bit of a, wow, last year was so much better for some students or so much worse for some students. So I think we're just prepared to kind of catch them, however that may be. And it sounds like, just from the people I've been speaking with, we've got a really great team, and I'm looking forward to partnering with them and promoting not just drug and alcohol prevention, but also just that healthy community, healthy, positive coping skill that maybe they were really missing out on, which is what I'm so glad Project Success really focuses on, is the positive parts of how to prevent drugs and alcohol, not just like, don't do drugs, you're gonna die kind of look at it. So I'm just curious to see, but I'm just able to be more present in our school and just make early connections. And so far it's been really well received. So I'm excited. I'm looking forward to this year.
Pastor Michael, what are you seeing as chaplain and as a spiritual leader?
Well, I first of all want to just take just a minute to thank Juliet and Amber, Kathy Jackson, Kathy Bernhardt, and Stephanie and Paul Ryan, Commander Ryan, for your front lines involvement in helping the students and helping our community. That's my passion as well. And I'm 100% supportive and thankful for you. So thank you so very much. As most of you know, I have a passion to see the McKinney-Vento families get some help with housing. I wish it was going a lot faster. I have a lot of wishes, would have, but looking for future. I'm working with Commander Ryan on the chaplaincy, trying to get some more chaplains. And as you know, I'm bringing awareness and involvement to the congregations and from the congregations and pastors in Monroe on the various things that we're all working on, really. Been on the Imagine Monroe Mayor's Sounding Board, and been working with Dr. Blasco in much the same way, Mary Myers, that we did with Dr. Prentiveau in the curriculum and various things, which I'm not going to go into, but just I'm busy. So, and doing good things, hopefully, and loving you all.
Kathy Bernhardt, what's going on?
And same to you, Pastor Hanford, Mary, and Tom. We cannot do this without your support and all your work too. So thank you. Take the headphones out because it's hard to do that. So I have good news, bad news. The good news is, kind of during COVID, we actually developed stronger partnerships, I feel. And so for what I do, that meant we were able to wrap around services. And guess what? Word spread. I'm getting cold calls every day from families who are displaced, who heard that there might be some help. So really good news. I'm glad the families are reaching out. I'm glad the word is getting out there. And it's coming from all different sectors, not just school. It's coming from our community partners, referrals in. So huge thank you, because this is kind of how we want it to work. We want to get that word out, because what is McKinney? No one knows what McKinney-Vento is, unless you work pretty much in the district office. But getting that word out, the supports out, the partnerships with the student support advocates that are listed at every school, not every school, but Joe, 5 of them, to really kind of support our families. The bad news is by the end of next week, I'll have processed through over 160 and counting. Last week, we ended the year at 206 McKinney-Ventos, 25 foster care. We will be at the number before December, actually probably maybe early fall. So it's going to be an interesting year. So some families will have to be patient, because I am triaging right now based on just needs as they're coming out. So that's why I said it's a good problem to have, but it'll be a lesson, I think, in patience for all of us as we're trying to get supports around these families.
Kathy, what's precipitating that? I can assume, but I'd be more interested in your insights.
Families are doubled up, so they're losing their homes. And so they're doubling up with relatives. Homes, and could be an apartment that they've rented, where one person has lost their jobs. So doubling up. I'm getting a lot of also unaccompanied youth this year, where the youth have been sent by a parent or guardian to come and live here in another family's home. So I don't have the exact number, but I would say I'm probably have already processed close to 20 unaccompanied youth, which starts here. That's significant, and for various different reasons, but it's the doubling up. We have multiple families living together for economic hardship, and that's one of the key components that separates out McKinney-Vento from a lot of other definitions, is that we do have, if you are doubled up with another family due to economic hardship, you will qualify, your family will qualify for services.
And from a substance abuse risk factors perspective, transition and mobility is a highly predictive risk factor. So all of these families are vulnerable to increased substance use as a result of this experience. Kathy Jackson, I deliberately did not pick you to go.
To win. So I am just really grateful for all the community partners that my position is able to just pull in. We had an amazing response to our resource fair. It was on September 2nd at Park Place, and we had our best guess, between 900 and 1,000 people came through and received resources. Our main objective was to get our free and reduced lunch forms filled out and all the other forms, but we were able to partner with the foundation, with Casey, Edelbrock's Foundation, Casey Smiles. They had backpacks and school supplies. We had hair cutting. We had the fire department was there with helmets. It was just an amazing day of just seeing our families, and just the community just really supported them. We had our YMCA was there. Our city of Monroe was there. Kathy Bernhardt, who am I missing?
We had Joe's team there. So
Yes.
Our mental health support team was there with a booth. We had district personnel. I mimic Kathy. It was a great event until we ran out. Kathy, you're on.
Yeah, we ran out of everything. We had changed the location. We changed the names. We had no idea what to expect. So we were hoping for 100 to 200. So our numbers way exceeded our expectations. So we'll know, we're going to have a meeting next week and download and know how to plan better. Also, I just am really grateful for the food bank. I was just working on, I send out letters to all the families of the schools that I support, and they weekly receive it's an opt-in program. If they choose to receive about a 5-pound bag of extra weekend food, and it's mac and cheese and snack food, and maybe some tuna, some meat product. And it's just a great way to supplement their weekend food to make sure our kids don't go hungry. So I really appreciate our partnership with our food banks, both Maltby Food Bank and Sky Valley Food Bank. And they also supplement our health room snacks. So when kids don't have snacks during the day, the food bank also donates some of those things too. And the foundation is amazing. We get a little bit of a budget, so we can also supplement with that. Our faith community is amazing. Cascade Church, once again, is just always steps up there. Today I received school supplies from the Maltby Church in Monroe, or in Maltby. They just dropped off bags of school supplies. So we are so grateful for all the community partners. So that's where I'm at, just receiving. I'm just the conduit. I receive it and I send it out. And I love doing that. But yeah, yesterday was school started and it was crazy. And we're all kind of just getting our bearings because we haven't done this in 1.5 years or 2 years. So it's all good. Thank you.
Mary Myers, anything happening in your world?
Well, a ton is happening in my world, but not related to the task and the passion of this group. I do have a question for Kathy and Kathy, and that is that I was speaking to a friend who is on the board for the Assistance League, Operation School Bell program. And she knew that I had managed that program when I was on board with the district, and wondered what was available to families in terms of clothing. Are there clothing banks locally? Because my friend was saying that they had gotten inquiries from families and were told, and then they told the families that Monroe does not participate in that program.
That is correct. In Operation School Bell we kind of suspended the service of taking your kids out to the warehouse back, I want to say almost, I got, I'm going to age myself, 2012. Right after I was hired here in the district, they suspended it.
Yeah, I was still there when we stopped doing it, but at the time we had local resources.
We actually,
in district as well as through churches, and I wondered what is available currently locally.
well, it's not quite locally, but we've partnered with an organization called Clothing for Kids for the past, I want to say 5 to 6 years. They're an organization that is out of Linwood, and students, we basically give the parents a form. They take the form, they make an appointment. They shop for a whole complete fall wardrobe, similar to Operation School Bell. And then they also get a spring wardrobe. For 90% of our families, that suffices. With 10% that have issues with transportation, it doesn't. But through Operation School Bell, they have a secondary program, which is the shop through Fred Meyer. They've kind of got that partnership. Ray Lynn, Lucy over there at the high school assists with that program and getting our high school seniors through Leaders and MHS signed up to go shop at Fred Meyer after hours. That happens right around the end of September, first part of October. And Ray Lynn with Jail Ven and Mortel coordinates that. So we do have resources for almost all of our families. At the resource fair that Kathy Jackson was just speaking about, we had all of those forms there, and we're helping families fill them out and show them how to make their appointments and get there. They're
Who's
providing
the primary contact person so that I can tell this woman that she can link our families back to a particular individual?
You're
she can call me, she can call Kathy.
Yeah, you can call me, or
okay.
each school counselor should have access to forms so they can talk to their own thing.
Okay.
It's
Thank you.
throughout, yeah, it's provided throughout the district for this.
Mhm.
Or also
So it's
Cisco
not,
at the
again,
foundation.
that's a perception issue, again, that it's not that there isn't something available to families. It's just that they may not be aware of what it is for whatever reason.
Yeah, I'm not sure, because like Kathy mentioned, we had 900 to 1,000 people show up at the fair.
Yeah.
Clothing for Kids has been something we have been actively pushing out again for the last 5 to 6 years. It's a great organization. I think some people just keep focusing on that Operation School Bell, and that's not the term we're using, so they think there's nothing. That's kind of my guess, but I'm not sure.
Thank you. I'll help spread the word as I can.
Yeah, also, Rachel Adams, with the service providers, she's aware, and it's time to update all of you on some of the things that are available through the faith community, through other groups. There's God's Closet, for instance, happens quarterly at the Seventh-day Adventist Church. At the Seventh-day Adventist Church, you know. And then there's several others. Take the next step. Some of the personnel are working with someone, but it's not all gelled yet, but they're doing a facility for free clothing. So we'll try to let you know about all that. Maybe I can send it to Joe and he can send it out. Yep.
Tom, any closing comments?
I'm glad this was recorded, and the great presentation you gave, Joe, and then the last half hour. The whole community needs to hear that and be aware of the things that are happening. But the thought I had before even the meeting was the craziness that we have to deal with. I just saw a thing that summarized it in a way that is just, there's a whole group of people that want to arm teachers with guns to protect them from shooters, but do not want them to wear masks to protect them from a pandemic. Now, does it get any crazier than that?
I love that you get the last word.
Amen. Thank you. And thanks, Joe, for just an excellent presentation and meeting. So thank you very much.
So hope to see you guys all in October. We'll have some updates and then we'll do this work together. I'm going to try to make this as little about jumping through hoops as possible. Thank you, guys.
Thank you all. Hey, Joe, stay on.